Hey everybody, I just wanted to make a quick video real quick, send out to all you guys before work tomorrow morning just to kind of update you guys on the office, coronavirus changes, and just some of the things that we're going to have to do to kind of make changes to try to prevent the spread of this virus as much as possible. Let you guys know at least that it is something that I'm thinking about and not just ignoring it. So first of all, I just want everybody to know I care about all you guys. I care about your family. And I just want to make sure that we're doing everything we can to keep everybody safe and healthy. So obviously this is uncharted territory. We've never seen anything like this before. Don't really know exactly what needs to be done. There's a lot of unknowns, but there are a few things that we know that can lower the risk. You guys may have already seen some of the information that's been coming out that's listed hygienists, dental hygienists are the #1 healthcare professional at risk for contracting this COVID-19. Dentists are #2, and dental assistants are #5. So definitely a real risk here that somebody could contract it. Good news is that we're all a young, healthy office, and a lot of times people may contract it without any symptoms at all. So as far as us as an office, it's not that big of a, not to say it's not a big deal, but I don't believe that it's something that will be harmful to us immediately. However, we do come in contact with a lot of people who are at a higher risk. My parents would be high-risk patients if they were in the area. So we definitely need to take precautions. We don't want to infect anybody that we don't have to. And so, like I said, the risks are real. And so one thing I do know for sure, it's already started, is we're going to see an increase in cancellations, and that's okay. We don't want people to feel like they're obligated to come. We definitely don't want to put anybody at a higher risk, and anybody that's having symptoms or anything like that, we certainly don't want to have them in our office that could spread that to any of us either. So anybody that's wanting to cancel for whatever reasons, I think we're going to go on and accept those cancellations. If I had a dental appointment, I probably would cancel it too, just because of the risk. I don't, for a lot of things, unless they're emergencies and things like that, if they need to cancel, we need to do that, and no penalties or anything like that. We'll just make that known for them. I did create a list of some items that we'll talk tomorrow morning in our morning huddle, kind of some precautions and some things that will change around the office, and some different things that we may need to order to try to get things going, to try to reduce the amount of aerosols come out. Cabotrons, we probably don't need to use Cabotrons anymore for a while, hand scaling only. Trying to use some of the little relief things that keep suction in there, because anything that's going to reduce the amount of saliva and the spraying of it, air water syringes, trying not to spray where we're creating splatter and aerosol, that kind of thing. So trying to implement things that are going to reduce that is really going to help us out as well. Also, if there's anybody works with us that just feels like, if any of you guys just feel like risk is too high and you don't feel like you're comfortable being in there, that's fine. Let me know. We'll figure out something, and you don't have to work. We'll make it right. I'm going to do everything I can we'll use vacation days. We'll use sick days. There's bills out there right now in legislation that are looking to see about unemployment, temporary short-term unemployment throughout the process. If things are having, a lot of offices, I know a dentist in Marietta that's decided to close. He's an older dentist. He's got a wife with autoimmune disease, and he said it wasn't worth it, and he's going to have to shut down his office. So I've always been really upfront and honest with you guys and about our finances, and we're still a young office, new office. Obviously had some strange things last year with the lightning, and so we've always operated on fairly thin margins at this point. We make our bills for sure. We're not struggling, but we don't have a huge nest egg sitting there so to pay out. So I definitely want to do everything I can to support you guys throughout the financial, but when the money runs out, we just obviously can't continue to do that. So there may be some times if it gets down to it that we're all going to have to just work without pay. Hopefully that's not the situation, and like I said, the government is working on some things, trying to make that some other options that could come out, whether it's loans or I don't know. I'm going to check with Matt Willis, my State Farm agent, as well, to see if there's loss of revenue, if this would qualify for that, and how that would affect us, since we've already taken that so much last time in there. But if anyone feels that risk is too high, please let me know. I'm sorry, I've got a couple notes. I just want to make sure I cover everything here. Let's see here. Talked about that. I created a letter. You may have already received it. We sent it out. Francis sent it out through Revenue Well about an hour or so ago, and just kind of letting patients know what's going on and all of that. Most importantly, I would say that if any of you guys start experiencing any flu-like symptoms, fevers, aches, upper respiratory colds, dry cough, anything like that, sneezing, let me know. It's kind of a hard thing right now. Allergies are definitely, pollen is in full steam, so a lot of that can be misconstrued. But if we start feeling like it's more than allergies, let us know. We don't want you there. We don't want to. We want to do our part, and we're asking that you would do a self quarantine for 14 days to just make sure that that's not there. There is good news. Wuhan, the province in China where the whole disease originated, has said that they are seeing a decrease in the rate of infection now for the first time, so it's turned the corner. Bad news is that from the first day of infection, the first case was 75 days ago, so it was a while ago, but there is a light at the end of the tunnel. We are kind of in that process following them, so hopefully we can stop that earlier. Hopefully the warm weather will kind of decrease the infection rate too. A lot of times flu and viruses do better in cold, dry weather. Not that we had dry weather, but it was cooler. So just know we'll get through this. We're going to try to stay our normal business hours, keep working as is, but if we see that we're getting a lot of holes in our schedule, we may try to contract our schedule a little bit and compact it together and maybe put people in 3 days a week instead of 4 days a week if we have to. That would limit our number of exposures, days of exposure, and we're able to stay there and just trying to stay as much as we can, and we're not just wasting time. Also, I know that, in this busy world, 24-hour news cycles and all of that really eat up on us, and I just want that high-quality sleep, good nutritious diet, regular exercise is all contributory to a healthy immune system. And so I would encourage you all just to take a step back, get away from the news, focus on yourselves, focus on your families, focus on your faith, really engage. Take this time. It's a forced slowdown right now, and that's not all bad. Sometimes taking a step back and being able to really focus on the things that are most important to us, with this social distancing at home and getting away from the hustle and bustle of the stores where people are beating up people over a roll of toilet paper. It's stressful, but just trying to focus on the important things in life. And you guys know that faith is an important thing to me, and I definitely believe that God is good, and I believe that He works all things for His glory, and I believe that the coronavirus is part of that too. So I praying for you guys. We love you guys. Thank you for working with us, and look forward to seeing you in the morning. Get a good night's sleep, and we'll see you then. Bye-bye.